Hi, I'm Dr. John Famberg. I'm a pediatrician and adolescent medicine specialist at Maine Medical Partners, South Portland Pediatrics. Next Steps is a series of training modules that were independently developed by Let's Go to complement the American Academy of Pediatrics National Initiative for Children's Healthcare Quality Next Steps products on childhood obesity. During this video, I'll be giving you an overview about the Next Steps program. It will also help you understand how the Next Steps themes can be integrated into your practice. There have been many funders and organizations who have participated with the development of this program and its content. For more information on the Next Steps online training modules, contact Let's Go at info@letsgo.org listed on this slide. For purchasing the Next Steps guide, contact the American Academy of Pediatrics bookstore's website, which is also on this slide. Before working with Next Steps, you need to also be familiar with what Let's Go is. Let's Go is a nationally recognized childhood obesity prevention program of the Barbara Bush Children's Hospital at Maine Medical Center. Let's Go uses environmental and policy changes to increase physical activity and healthy eating for children between birth and age 18 years. Through a multi-sector model, Let's Go integrates similar messaging in 6 different areas where patients and families live, learn, work, and play. And the core message for Let's Go is the 5210 mnemonic, a message which is evidence-based. It stands for 5 or more fruits and vegetables, 2 hours or less of recreational screen time, 1 hour or more of physical activity, and 0 sugary drinks. Drink more water and low-fat milk each day. Next Steps is a different program. It's a complementary program of Let's Go. It is a program of planned follow-up visits that practitioners can use with their patients to create behavioral change. It's for the patient who's ready to work on their health. It uses a combination of up to 18 themes to create successful change. This slide shows you an overview of the many visual modules created for Next Steps. A similar slide will be present at the start of each of the Next Steps videos in order to give you a reference as how the videos interrelate. This specific video will give you an overview about Next Steps and will introduce you to the ways that you might be able to integrate the themes into your practice. Next Steps was developed by Let's Go in Maine in 2010. Along the way, many organizations, including the American Academy of Pediatrics, the National Initiative for Children's Healthcare Quality, the Maine AAP, and the AAP section on obesity, as well as many individuals participated in making the final product come to life. There are 2 components of the Next Steps products. One, the guide, which gives the background information and how to apply Next Steps into your practice. And 2, the flip chart, which gives greater detail about each individual theme that you can choose to use. Next Steps uses planned theme visits to address obesity. It is best for the patient that's engaged and committed to making change. It provides structure, format, and content for the visits. We expect that it requires a long period of patient commitment to be most successful. The U.S. Preventative Services Task Force has suggested that this may be as long as 6 to 12 months with many touch points. And as I'll discuss later, this may not all be with the practitioner, him or herself. Providers will find that motivational interviewing will be important for this to be successful. Many providers have found these skills to generally improve over time as they get used to the material. And most importantly, it's a combination of the patient, the family, and the provider that decide on which themes are used. The themes and Next Steps have been tested in many types of provider settings. We identified 18 themes that seem to be effective with working with children. These themes were divided into 3 categories that we have labeled as A, B, and C. We believe that the one theme in category A is a fundamental building block that is likely to be useful to almost all patients. The 6 category B themes include themes that are likely to have early and quick payoff, thereby motivating further commitment and change for the patient. And the 11 category C themes can be used further in the work with patients as appropriate. With the many themes, you'll be asking, how do I choose a theme? Well, we believe that you should choose the theme with the greatest payoff earlier in the plan. This typically would be category A or B themes. You'll also want to choose themes based on how your own expertise and knowledge exists as a provider. I may feel really comfortable with sugary beverages, hence I'll prioritize that theme. Yet I may be uncomfortable with label reading and will outsource that theme to my nutritionist or avoid it altogether. And you may also choose the theme based on a patient's age, their readiness to change, their habits, such as if they watch television or if they don't watch television, or even based on their BMI. While using themes, you'll want to adapt the material to include the patient's and family's culture into every visit. And you should also use universal messaging across all visits, such as 5210. This slide shows the title of all the themes and their categories. Understand Your Health is the name of the theme that is in Category A. We believe that this theme will likely be used on almost every patient as a way to set the groundwork for other themes. Category B themes are listed here. These are the highest payoff themes and will be used earlier in the planned visits. And Category C themes are now listed. These can be used with patients further along. It's been important to realize that you may choose not to use every theme with every patient, and will have to individualize the choice of themes for each patient. Each theme was developed to be accompanied by a couple of things. The name of the theme is listed on the left. On this page is the theme Understand Your Health. Each theme in the Next Steps guide is accompanied by key teaching concepts of what the theme might consist of. With Understand Your Health, this might be the fact that the health is determined by many components, such as genetic component and a family or environmental derived component, or that the goal should focus on maintaining or improving one's health status instead of permanently fixing the health. In the Next Steps chart, along with the theme's content, each theme also has practical details that a provider may decide to use. You may find the phrases box useful in the beginning. It has language that can be used with the patient to elicit history related to the theme. Much of the language includes open-ended questions and tenets of motivational interviewing. For Understand Your Health, sample language might be, can you tell me more about how you've tried to get healthier in the past? Or how do you feel about the goal of keeping your BMI the same? Some of the theme pages also have a section titled Facts or Ideas to Try or Examples, which may give nifty tools or added insight with regards to the theme. In the theme, Understanding Healthy Foods, the box suggests that the patients may find foods healthier if they can be found in nature or on a farm. In the flip chart, each theme page has an opposing page that was designed to face the patient and the family. This can be used as a teaching tool as well, and it can be used while talking with the patient as it highlights key messages of the theme, and it is patient-friendly wording and patient-friendly pictures. We realize that most doctors only have 15 or 20 minutes with each visit. This might be a template on how the visit could look in your office, especially as you become more accomplished with Next Steps. The first 5 minutes is check-in, a time when the weight, height are measured and the BMI percentile is plotted. As well, this might be a time to ask how things are going since the last visit. The next 5 minutes can focus on reinforcing successes since the last visit, as well as understanding barriers to achieving success. It's critical to understand barriers in order to be able to remove them and allow for success. A physical exam will likely need to occur as part of the visit, but likely also has the least value of the visit. This might even be done simultaneously while you're talking with the patient. And the theme part of the visit is the unique part of each visit. During this time, you'll identify and pull out a theme that's most applicable to the patient. And although many visits only include one theme, you may use a combination of a couple themes. And lastly, you should spend some time focusing on follow-up. This needs to be a proactive process. Follow-up for childhood obesity is hard. It's one of the most difficult things about working with these patients. Some providers have found it easier to tie follow-up visits to some other medical reasons, such as a recheck for asthma or to discuss lab results. If the patients have an early success with a program, they're more likely to follow up. Stack the deck in your favor. Patients need to see value to their visits. You could consider having the patient and family define the date or frequency of follow-up. This may give you an indication as to the patient's readiness to change. And some experts advocate for providing something tangible at the end of every visit, such as a prescription or a written agreement. And lastly, create an atmosphere of fun. We've learned from many patients that this can be the number one reason for following through on a long-term plan. Follow-up doesn't need to be with the doctor. There are many other types of providers that can be enlisted with planned visits, and this may vary based on what's available locally. Although we've listed which themes might be outsourced to certain types of providers, we've learned that the skill set of the provider is much more important than the letters after their name. So you've heard the overview on Next Steps video trainings. These were independently developed by Let's Go as an adjunct for Next Steps guide and flip chart printed by the American Academy of Pediatrics. The videos echo some of the same content as the Next Steps, but also have some practical aspects about how they are applied to practices. Some discuss how individual providers have succeeded with applying next steps and applied them in practice, and others talk more globally about the theme itself. Following most of the other videos is a short quiz, which will hopefully help with retention and synthesis of the material taught. By watching all the videos, we hope that you'll get an even greater appreciation as how next steps can be applied in your practice, and we believe that they're best used along with the next steps learning guides. We hope you enjoyed watching these next steps videos. Good luck with treating your patients.